Hello, and thank you for joining us for Methodist Healthcare's Breast Cancer Series. This series will provide you with the tools to empower you to take control of your breast health. Joining us today is Dr. Justin Boatsman. He is a breast radiologist, and we'll be discussing early detection and screening. Dr. Boatsman, thank you so much for being here. Could you tell us what is the best way to detect breast cancer early?
Well, the best way to detect cancer early is a combination. One is the screening mammogram. It can detect cancers up to 2 years earlier than the physical exam can. It's probably our #1 best tool, but it can't catch all the cancers, so it really does need the complementary tool of physical exams. So between those two things, that's your best step towards catching cancer early.
Okay, and going to that mammogram, can you tell us at what age do women start getting that annual mammogram screening, and why is that so important?
Women should have the opportunity to start screening at age 40 and then annually after that. That's the regimen that will detect the most cancers, the smallest and the earliest, and give women the best chance in the battle against cancer.
Okay, very helpful. And you know, a lot of times I think women, we build things up in our mind and we hear and read things that might make us uncomfortable. So can you just walk us through what the mammogram process is like? Is it scary? Does it hurt?
Sure. Anytime you're having a medical test, I understand that there can be some anxiety involved, especially a test where you're trying to figure out if you have cancer or not. I wish that the test was completely comfortable, but it does require some compression there, and everybody's a little bit different. That being said, we really try to make the process as comfortable as we can. We try to have a nice environment, and it really is a test where the technologist and the patient interact. The patient is always in control, and so when they need to take a break, whatever they need, just talk to the technologist and they'll get it through them. It's very rare that we can't get through the test and get exactly what we need.
Okay, and if a lump is detected in a mammogram, does that always mean that the lump was caused by cancer?
That's a good question. Everything that we find on a mammogram is not cancer. In fact, most of the things we find are not cancer. They're going to turn out to be okay. And our tests are very good at telling us what's cancer and what's not cancer. In the breast, we have a lot of things that overlap. We see very commonly little areas that cause pain and symptoms. A lot of these things turn out to be just breast tissue that got caught in a little different way. But with a few extra images or maybe an extra test or two, we can usually resolve those and figure out what we're dealing with and what we need to do.
If cancer is detected, what's the next step?
So once we figure out that there is a cancer there, the next step may be determining how much cancer is there. You're also going to get plugged into a team of different types of doctors, surgeons, oncologists, and that whole team is really going to guide you through that process of removing that cancer and any other treatment steps that are needed. And we're fortunate here in San Antonio to have a very good group of people who work very close together. And Methodist has a great program called the Navigator Program, which is free to the patients. It really is a single point person that can guide them as they're going to these different offices and different places. They're going to consistently be that reference point and get them through that process and answer their questions and get them where they need to go. The #1 thing is everything that we've talked about doesn't work if you don't go see your doctor and you don't get your screening mammogram. So if you haven't gone in and had a screening mammogram, please go in and do so. If you have any symptoms in your breast you haven't let somebody know about that's new to you or different, please let somebody know and get that worked up.
Thank you. That's very great advice, very great information for us to take away, and thank you again so much for being here. And remember, early detection saves lives. We challenge you to schedule your annual screening. Just go to makeyourmammo.com to schedule your mammogram today.